Coding Corner Medical Coding Education. My name is Rebecca Broyles, and I want to talk about tiny patients, big rules, and mastering pediatric coding. Talk about why pediatric coding is unique. Pediatrics isn't just adult coding scaled down. Many services are age restricted, and documentation often includes parent input. Vaccines and screenings are major components of pediatric visits. Some examples are the age-specific CPT codes, growth-based medication and procedure considerations, vaccine-heavy encounters, parent-provided history, and developmental and behavioral screenings. Pediatric Evaluation and Management Coding Overview. You have your office visit evaluation and management codes, the 99202 through 99215 ranged. It's based on medical decision making or total time. Those are like normal E&M codes. The history and exam only when it's medically necessary. The E&M changes apply to pediatrics too. The medical decision making often includes growth concerns, feeding issues, or parental anxiety, which can increase complexity. Well child visits are foundational in pediatrics. These codes are age-based and include a wide range of preventative services. The 99381 through 99385 range is for new patients. The 99391 through 99395 are for established patients. The code selection is based on the patient's age only, and it includes screening, counseling, anticipatory guidance. Here are add-on codes that are common during well child visits. These are frequently missed. Developmental and behavioral screenings are billable when standardized tools are used. The 96110 is for developmental screening. The 96127 is for behavioral assessment. The 99173 is a vision screening. The 92551 is a hearing screening. The 90460 through 90461 range is for immunization administration with counseling. Pediatric vaccine coding is complex because many vaccines have multiple components. Counseling must be documented to use 90460 and 90461. Here you see the 90460 is the administration code for the first component with counseling. Then the 90461 is an add-on code for each additional component. So the two required components for a vaccination administration is the actual vaccine and the administration codes. Now, pediatric sick visits often involve parental concerns, which can increase the medical decision making. Document the complexity clearly. That way, if your documentation is audited, there will be no question on why you selected the code you did. Some sick visit coding in pediatrics can include, but are not limited to, acute infections such as otitis media, strep, RSV, some chronic conditions, asthma, ADHD, eczema. You can have injury visits or even medication management visits. Newborn care codes apply only to infants under 28 days. Delivery room attendants and resuscitation have their own codes. Pediatric procedures often require additional documentation due to cooperation challenges or parental involvement. Modifier 25 is especially common when a sick visit occurs during a well child visit. Documentation must support separate services. Here we see some modifier use in pediatrics, the 25 that we talked about, significant, separately identifiable NM, 59, a distinct procedural service, 24, an unrelated NM during a global period, 33 for preventative service, and SL for state-supplied vaccines. Pediatric ICD-10 coding often includes Z codes for screenings, exposures, and social factors. These codes justify services and improve documentation. Some common pediatric coding errors are missing developmental and behavioral screening codes, incorrect vaccine administration coding, forgetting the modifier 25, using adult procedure codes, and not capturing the Z codes. These errors are common, but they are preventable. Pediatric encounters often include multiple billing components. Some best practices are use standardized screening tools. When you use the standardized tools, the documentation is there. The provider just has to input the information in the tool. Document vaccine counseling clearly. Capture all vaccine components. Review your payer-specific rules. And educate providers on documentation essentials. Provider education is key. Many missed codes stem from incomplete documentation rather than coding mistakes. Some case examples. Here is a well child visit, a 4-year-old well visit with a developmental screening, a vision screening, and vaccines given of MMR and varicella. This case shows how many add-on codes are appropriate during a routine well visit. Missing these is a common revenue loss. Another is a sick visit, 2-year-old with fever, cough, and wheezing. They did a nebulizer treatment and performed an RSV rapid test. Here you see the codes that would be applicable and the modifier that you would use on the ENM code. The nebular treatment is a procedure, so the ENM code would require the modifier 25. However, documentation must show the separate work. Newborn care. Newborn, normal newborn, initial hospital care, breastfeeding counseling. Some payers bundle counseling, others allow separate billing. So that's why it's so important to always check your payer-specific policies and guidelines. Thank you for watching today, and please visit us at the Coding Corner Medical Coding Education at www.thecodingcornermce.com.